Hello. So we hit our highest number ever of COVID patients in the house, as well as total number of patients. That means that our 3 facilities were very, very busy. And I know that that has created a lot of stress for many of you. Obviously, the red visitation does not allow you to see your loved ones. And I certainly have heard from many of you about the struggles of that. And I understand how difficult that is. We have been able to fill volunteer slots to have volunteers come in from our staff throughout the organization and be able to provide FaceTime and other opportunities for you to speak to your loved one. But when you can't be there, I know it causes a lot of stress, and I am tremendously sorry for that. We are starting to see the numbers go down, numbers of COVID patients, that is. Our total volume continues to remain very, very high, and our emergency rooms are very, very busy. All of this is just as a reminder that this Omicron variant is very, very virulent. The transmission rate, while it has dropped from the 1.9 it was to 1.25 this week, it still remains over 1. And that means that we still need to make sure that we are masking, we are washing our hands, remaining socially distanced wherever possible. Appointments can be scheduled for vaccines and boosters. And again, we have daily appointments available, so please check the website for those. The testing, obviously you've heard that the White House has issued new rules that allow health insurance to cover 8 tests per person per month for a total of 32 tests that will be covered under your health insurance plan. And that's a tremendous relief for people to know that they can get that. The only challenge is, of course, we have a shortage of tests. So we are doing our best to meet your needs, and we'll continue to do so. So January is Cervical Cancer Awareness Month, and there are 14,000 Americans that are diagnosed every year. So we encourage you to consider making sure you get your annual visits in. And Catherine, one of our patients, talked about just the feeling that she got at the West Deptford OBGYN Center. Catherine, when she walked in, would really get that sense of family, right? Jen and Jackie at the front desk always welcomed her, always make sure she had her appointments, always made sure she knew what the next steps were, and she really felt connected. It is so important to make sure you have that team around you that's helping you every step of the way. In addition, I heard from Shirley Spurbeck this week. Shirley came to Sicklerville about 6 years ago, and when she was looking for a primary care office, she really wanted somebody that would connect with her. And sure enough, she comes in, she meets Trudy Mosley, medical assistant. They immediately have that symbiotic relationship where they're laughing and talking to each other and staying in touch. And then she meets Dr. Tara Bullock, who again really works with her on her health goals, on making sure that she understands the information that's being given, and has a real relationship where she feels that investment by Dr. Bullock. The consistency that you hear between these two stories is really making sure that we have those personal connections, because it is more than a transaction. As your healthcare provider, we are engaged in this fully with you, and we very much want to continue to walk that health journey with you. This week, we honor the life of Martin Luther King and his commitment to service, hope. His passion and his calling was around social justice and the civil rights movement, really calling for equality for all. As we continue on that journey, even to this day, the laws have certainly been changed, but living into that and making sure there is that equality, that opportunity for us to all walk together on different paths, but with the same access to both care as well as opportunity, is really what he spoke of. Today, as we face our own challenges, whether they be in reference to racial justice or whether they be in reference to the pandemic that we're facing, it is so important to hold on to that hope, to understand that the day that we stand in is not the day that we live in forever, but that we must be able to hold on to the hope of glory for the future, for each other, for a better world, and for our sense of community. Until we meet again, be well and stay safe.